Okay, so the question is, when coding continuous nerve blocks 64415, 64446, or 64448, how do you code for the follow-up when the patient is sent home with the catheter and the follow-up is being done via telephone by the anesthesiologist? Okay. It's my understanding that you can't directly bill for a phone follow-up, but if you document the call and you review those notes at the next face-to-face visit, then you can count it toward data reviewed as part of the medical decision-making. So you can't really get paid for it, but you can, if they're going to come back. So there are CPT codes for telephone calls, and a lot of physicians, when they see that, they're like, I knew I could get paid for telephone calls, but we have to remember that just because a code exists in CPT does not mean it's billable. CPT was originally designed just to track everything that a physician did, not necessarily for billing. It eventually became, used for that. The guidelines also say if the telephone call refers to an E&M service performed and reported by the physician within the previous 7 days, either the physician requested it or it was unsolicited patient follow-up, or within the post-operative period of the previously completed procedure, then the services are considered part of that previous E&M service or procedure. So basically, it's kind of like a global package. So that phone call to the payers, they consider bundled into the service that was already billed. And that's pretty much what I've found, that most insurance companies will not pay for these phone calls, even if it's outside of the 7 days. It's just really considered standard of care, and most people do not charge for it separately.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.